I don't have time to thank and acknowledge all the people who helped make this event possible and the special guests who are here, but I do want to mention two. Las Vegas's great Congresswoman Shelley Berkeley and Elizabeth Ed, who will be with us this morning, whose grace and strength through her own health care battle with cancer is an inspiration to us all. We pray for her success. The Center for American Progress Action Fund is proud to co-sponsor this event at UNLV and SEIU. This forum is not only the first to focus completely on our nation's healthcare crisis, but it's the first presidential forum ever to take questions directly from the blogosphere via thinkprogress.org and courtesy of a live webcast provided by Real Networks. We hope that what happens in Las Vegas today will actually leave Las Vegas and set the tone for the entire presidential campaign. It is simply time to make affordable, quality coverage for every American a reality. I don't need to tell Nevadans that our healthcare system is in desperate need of a fix. More than 430,000 Nevadans, almost 1 in 5, lack health insurance. In terms of healthcare costs, Nevada had the highest percentage growth in health expenditures of any state over the last 25 years. The situation in Nevada highlights concisely what's wrong with our healthcare system overall. It costs too much, it covers too few, and it delivers too little in terms of health of our citizens. Today, 45 million Americans are uninsured, including 9 million children. Since 2000, healthcare premiums for workers have increased 4 times faster than wages. Today, the average family insurance policy costs $11,840. That's $1,000 more than a full-time minimum wage worker makes in a year. What kind of value do we get for all that money we spend on healthcare in the United States? Not much. The U.S. currently ranks 31st in the world in terms of life expectancy and 28th on infant mortality. You know, I think my grandparents who came to the United States from a village in Greece 100 years ago would actually be shocked to know that people living in that village today have a longer life expectancy than people living in the United States. And in our globalized economy, American business isn't faring any better. By 2008, healthcare costs will exceed profits in Fortune 500 companies. Our healthcare system today violates America's deep commitment to human dignity for all and fairness for all, and it hampers our nation's economic competitiveness. The upcoming presidential election presents us with an opportunity. We can find leaders who are willing to reject the status quo and provide fundamental change. We're pleased to have so many candidates with us today, and we're also grateful to have an exceptionally talented and accomplished moderator, Karen Tumulty of Time Magazine, to lead today's discussion. Now let me introduce my good friend and ally, Andy Stern. Andy's an organizer, a visionary, and a true champion of workers across the country. Under his leadership, SEIU has become the fastest growing union in the nation, the largest healthcare union in the U.S., and one of the most powerful political forces in the country. I'm personally honored to partner with him on this and other efforts, so please join me in welcoming Andy Stern.